to reiterate one thing that Dr. Bill said. The truth is, he was kind of the driver in this system, in this process, and I was the navigator. So it really was his vision that started us, and then I kept making sure we were steering in the right direction, so to say. But our staff did an amazing job at adapting. And I don't want to single anybody out, but some of our older staff who we were concerned might not jump into the computer age were among the best at taking on the challenge and embracing the new system. My part in this is to talk about the process for just a second, and I guess what I would say to doctors who are considering this is, first, do it, because you will ultimately reap the benefits. Secondly, take advantage of all the resources available. We started with the Nebraska Medical Association program that gave us ideas about how to evaluate a system, how to go about the process, what to think about in terms of expense and cost. And then we finished with Wide River, who helped us meet the criteria for meaningful use. The second thing is pick the right system. We have never for a minute regretted choosing EMDs. EMDs has met and exceeded every expectation, and it's a tribute to the quality and detail of the system that literally we still discover something new that EMDs does about once a week. We find out about, oh, you can do that there. And the third thing is make sure that your staff is adequately trained and persist. There were certainly a few days at the beginning where we wondered if we were going to get over the hump. But suddenly you turn around and you realize you're answering your messages in 20% of the time it used to take, and you're generating records in 50% of the time it used to take, and your hand's not cramped from writing prescriptions all day long. And although I'm not sure how much they realize it, I do believe that ultimately the patients are more satisfied as well as being better taken care of because we have this system and it's working for us. Thank you.
Well, I would like to introduce also Lorelei Schieferdecker. She's from CMS, and she would like to say a few words as well.
Thank you, Todd. We at CMS are thrilled to be able to recognize Dr. Weeks and Dr. Woodruff, who have made the commitment to adopt the electronic health system and then use it in a meaningful way, not just to use it to make sure that the outcome is what is wanted, the better patient quality care, the lower cost and the greater efficiency. You've completed every step there was to achieve that goal. We recognize that your commitment, the transition, took effort, it took time, and it took resources. You guys are pioneers that are helping lead the healthcare of the nation of our future, but more importantly, the people, excuse me, who really benefit from all of this are your patients. They're the ones who are going to reap the benefits of a more coordinated care and more efficient care. For those of us in the CMS regional office in Kansas City, the recent disaster in Joplin really adds to the mounting pile of evidence that electronic records are more secure than the paper ones, which is one of the reasons why the government has put billions of dollars into this electronic health record technology. That devastating tornado that ripped through Joplin on May the 22nd completely destroyed a number of physician offices. Thanks to electronic health records, one physician who was already on board, like Dr. Weeks and Dr. Woodruff, was able within 3 days to reopen her practice. There are a lot of physicians who aren't going to open again. She was up and running in 3 days. You've probably heard of the medical records and the x-rays that were found in Springfield, Missouri, which is 75 miles east of Joplin. However, the hospital that those records were from had joined their parents' electronic health system 3 weeks prior. 3 weeks prior, everything was electronic. They didn't lose a thing. They were able to be up and running, set up a 60-bed mobile hospital in 3 weeks. Would not have been possible without an electronic health system. So the patients of Dr. Weeks and Dr. Woodruff should something ever like that happen, will know that their care will be up and running. They can go to the pharmacy, get their prescription. I mean, it really is an testament to the advancement you guys have made. So we're hoping that other providers will learn from the two physicians, learn from the situation in Joplin, and then take advantage of the incentives that we've provided to the eligible participants. So on behalf of everyone at the Centers for Medicare and Medicaid Services, thank you guys so much.
Well, in recognition, if you could do that, I'll have Lorelei help me out here. In recognition of being part of the Meaningful Use Vanguard, maybe I should do this so everybody can see it. We'd like to present this certificate on behalf of the ONC, the National Meaningful Use Vanguard Program, for your guys' continued excellence in adopting these health information technologies, and then also being peers, educators for all the other physicians in this community. So please keep it up and continue to shine.
Thank you.
We have one more thing here. We'll ask the Lieutenant Governor for assistance here, but these are plaques that we would like to present to both physicians. We'll present one to Dr. Woodruff first, and then to Dr. Weeks. They're the same. This is actually for the two clinics for Southwest Family Physicians, because we know that both sites did a lot of work in order to reach for this star, and you guys definitely attained it. So congratulations to everyone. And then,
Let me make one point.
sure.
These plaques say Gretna Family Health and Southwest Family Physicians. They don't mention a doctor. These are awards for all of our staff and everybody that works so hard to make this a reality. So I want to share it with everyone here.
And then, of course, last but not least, Cindy, I think we wanted to recognize, we have a little token for you. It's a pin that we have of a star, and if we don't have it here, we can get it out here in just a little bit. But really, to show that there's always a leader as we go through this, and actually if we could ask the PA, Kathy, is that right?
Chris.
Sorry, Chris. Here we go. I'll try to get out of the camera way here. These are little stars, because again, we believe that you guys really did. You set your goals, high as the heavens, and you reached up, and you guys helped pull that star down to improve healthcare in Nebraska. And so we hope you wear them proudly. We have one for every staff member as well, so that you guys never forget this. You guys really, really excelled as being one of the first healthcare sites in the nation to meet this historic milestone. So once again, congratulations to everyone, and it was a pleasure. Pleasure. And with that, we will conclude. Thank you for everyone's time. I'd like to especially thank Lieutenant Governor Sheehy for showing up today, Drs. Weeks and Woodruff for hosting us as well, and for everything that you do, Lorelei for attending from CMS, and obviously all of you for all of the efforts that you guys have done. And special thanks again to Patrick from EMDs for showing up today and helping provide refreshments for everyone. It's been an outstanding day, and it's been an outstanding process to go through with each of you. So thank you.
Thank you.
Thank you.